everyone, Dr. Strickland here, week 5. Okay, this week focus in on states of consciousness. Now last week I actually posted a discussion question on dreams, so that is going to be your discussion question for this week as well. So go ahead and look at those dream theories. I have to say that there's chapters that are favorites of students, having taught general psychology for so long. And states of consciousness, besides personality and serial killers, I think this is the second favorite chapter for general psychology students because we're talking about sleep. So I want you to focus in on those stages of sleep. Now, there's a little bit different in your book than what the Sleep Institute states as far as stages. The Sleep Institute actually follows 5 stages of development. More than welcome to log in and look at how that progresses. So pay attention to the stages of sleep and REM versus non-REM, because I hear a lot of people say, oh, I don't dream. Yes, you have REM. You may not remember it, but think about the fact that if you're using an alarm clock, it may go off in a stage in non-REM, so you were not dreaming to begin with. So look at the stages of sleep, look at the dream theories, and think about which one makes sense to you. Now, there's a couple that are in there that focus in on more of the cognitive aspects of dreaming and the biological. I think those are some good ones. But again, Freud is so popular. And so you think about the symbolism. I think we know there's a cognitive and biological mechanism to dreams, but what we dream and the symbols, we're always trying to figure things out. Yesterday, my son and I were having that conversation. I actually asked him, this is kind of interesting, have you ever felt something in your dream? Like I felt a bite in my dream and it woke me up. This was like 2 nights ago. And one of my cats sleeps with me and I thought maybe she just popped me. And when I woke up, she wasn't anywhere around me. And I thought to myself, that was weird. So think about, do you smell things? Do you dream that you are the participant? Or are you standing back like watching a movie? Do you have certain colors in your dreams? Is it day or is it night? There's so many different aspects to dreams. I think everyone's fascinated in dreams. So think about your perspective, look at the theories and kind of think which one makes sense to you. And then of course there's drugs in this chapter as well. That's a huge part of psychology, especially for us in clinical and counseling psychology. We do have the training in chemical dependency, substance abuse. We have that training to work with patients in that area. So pay close attention to the classifications. You're looking at depressants, stimulants, and of course hallucinogens. So kind of see how that fits in. Some drugs actually fit in more than one category. Most people think, so for instance, alcohol is just a depressant, but it's actually a stimulant as well. You think about something like MDMA, or you say ecstasy, that actually fits in as a stimulant and a hallucinogen. So anytime that a drug is created or we come up with a different type of drug, and there's been some that have evolved in the past couple of years, we have to sit back and think from a neurological perspective and a consciousness perspective. How do we fit that drug into that category? And what are the long-term effects of consciousness? Remember, some of these psychoactive drugs can have permanent changes to your behavior, to your thinking, cognition, and to your mood. So you have to think about how that will affect you, not just in the moment that someone is using the drugs, but how that overall permanently changes their behavior. So just a really, I think it's just a chapter that has just a lot of information about what we study today in psychology, and I hope that you can benefit from this chapter, and maybe will stir some of your curiosity as well, especially in some of the areas of sleep and dreaming. We have a lot of sleep disorders. Pay attention to the sleep disorders, a lot of sleep issues. And then we also, as you know, have an enormous amount of drug issues in this country as well. So, and I'm home all this week. So if you have any issues, anything like that, just let me know, text me. And if you have any Blackboard issues as well, we have LTech, amazing people. Give them a call. They will definitely help you out, okay? Any problems, I'll be home. It's really hot out. Bye.